Within hours of a call for help, this medical team is flying out of PNG's capital, Port Moresby.
We've got a request from the Morobe Provincial Health Authority to medevac a COVID-19 patient.
They're heading to the city of Lae to pick up the man who's sick with coronavirus.
They usually get referred because the provincial hospitals don't have the capacity for more high dependency patients.
When cases spiked in March and April, medevac requests increased almost threefold.
We did get a large surge at one stage, and it was more like triaging which was the most important one to move first.
We all don the jumpsuits, and those usually stay on from the time we load the patients till we get back to Port Moresby. It's a bit of a struggle trying to make radio calls with a mask on, but we've managed.
This patient will be treated in Port Moresby. But there's also been a jump in demand for international evacuations, mostly for Australian citizens and residents, a task now more complex than usual.
We did see some things that may take 2 or 3 days now taking 6 to 7 days, and it'd just be nice to be able to streamline that.
Local company Tropic Air is doing almost all of the flights because of the quarantine restrictions that Australian providers would face if they flew to PNG to pick up a patient. It's also had to juggle requests to airlift people from places like Nauru and Timor-Leste. There's no guarantee that Australians who contract COVID-19 in PNG will be able to return home for treatment. The ABC is aware of 2 people in recent weeks who had their requests for a medical evacuation to Queensland rejected. The Queensland Health Department says it has strict policies and processes in place to assess requests. The Australian Health Department says medevacs are coordinated directly between providers, clinicians and receiving hospitals, and insists that arrangement is functioning effectively. It's night time when the crew arrives in Port Moresby with their latest COVID-19 patient. He's fortunate, as not everyone can afford the high cost of a medical evacuation. But with another wave of COVID-19 cases predicted in the coming months, demand for these services will likely soar again. Natalie Whiting, ABC News, Port Moresby.